Hello, my name is Dr. Diamond. I'm going to be your primary care doctor. I see that this is your first time visiting with me today, correct? Well, it is very nice to meet you. Welcome to the clinic. Let's go ahead and take a look here. I'm just going to look at your new chart. Mostly what it's going to be today is just some paperwork and some questions. I'm gonna just need to ask you a few things that I'll give you a good look over, make sure everything looks good, and we'll get you out of here, alright? Okay. Can you first please confirm your name for me? Okay, thank you. And what is your date of birth? Thank you very much. Okay. And what gender do you prefer to be classified as? Okay. Do you have any diagnosis or significant health conditions that have been diagnosed? Okay. And how long ago were you diagnosed with that? All right. How about any previous surgeries that you have had? Okay. And about how long ago was that procedure done? That's fine. Good. You'll notice a lot of these I'm going to be asking questions. You can just say yes, no, or just elaborate a little bit. That's kind of the paperwork part, and then it'll be more hands-on, okay? Okay. Alright, so is that all of the procedures that you've had then? Okay. What about your current medications? Can you tell me what you're currently taking, if anything? Okay. And what is the dosage? Do you remember the milligrams? Once a day, twice a day? Okay. How long ago, or how long I should say, have you been taking that medication? Okay. And what was the diagnosis that caused you to be prescribed that medication? Alright, thank you. Any other medications you're currently taking? Okay, that's fine. We can write that down. Good. Do you take medications independently, or do you have someone that helps you remember to take them? By yourself? Okay. And do you have any allergies that you are aware of? Okay. And what are your symptoms when you have this allergic reaction? Okay, shortness of breath. Anything else? Okay. Now, I'm going to ask you about a couple different vaccinations, and you can just tell me if you have had them or if you're not sure. Your tetanus vaccination, have you had one? Okay. And about how long ago was that? Alright. So it's recommended every 10 years, but that is perfectly fine, or as needed. And how about hepatitis B vaccine? Have you had? It should be in a series of 3 different vaccinations. Okay, not sure. That's okay. How about your influenza vaccine, your flu vaccine? Have you had that this year? Okay. Alright. Have you been screened for tuberculosis? Okay. And that came back negative? Great. About how long ago? It's about recommended every 2 years. Has it been longer than that? Oh, okay, good. Alright. Okay. Have you been hospitalized recently for any reason? Not recently? Okay. Okay. So now we will do an evaluation, and I'll continue asking you questions as we go along. Okay, let me grab something here. Alright. Good. I will ask you a few things, nothing too in-depth. It will be quite simple. And then we'll get you out of here. I'll make it quick. I see that the nurse did not write down what your height is. What is your current height? Do you know? Okay. Good. That's all right. Approximation is fine. And what is your weight? Okay. Good. Okay. So what I'm going to do is look at you as is, so just how you are sitting right now, evaluate you. Then I will listen to your heart and lungs. I will also take your blood pressure and make sure that everything looks normal for you. Check your eyes and all that, okay? So do you have any current concerns or anything that's feeling odd compared to normal? Okay, good. What I'm just going to do, just look straight ahead. I'm going to take my light and just look at your eyes. And I just want to make sure that they are both dilating correctly at the same time. Good. And now what I want you to do is follow the light with your eyes without moving your head. Okay. Good. Okay. Very good. Go ahead and just tilt your head back. What I'm going to do is just touch your nose very, very gently and just move it back so that I can look up your nostrils. Alright. Good. That looks good. And go ahead and just open your mouth for me. And I'm just going to look at the back of your throat. Okay, and say, ah. Good. Very good. Now I'm going to feel around here, under your chin and on your neck. And I'm just feeling where your thyroid is. Is this hurting at all, or is it sensitive, or does it feel good? Okay, good. And how about as I tap down the sides of your neck, does that hurt at all, or does it feel normal? Okay. And behind your ears. I think that feels good. Now, do you wear prescription glasses, either for long distance, reading, driving, any of the above? Okay. 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 Now your nose looks good and mouth and throat looks good. I'm going to just look in your ears here. Alright, and this one over here. Good. They look good. Are you having any difficulty hearing or? Oh, okay. And how about your nose? Are you having any runny nose, anything mucus in the back of your throat, or anything like that? Very good. Now I'm just going to feel here on your cheeks. And I'm just feeling for any lumps or abnormalities up here on your forehead. Good. And you haven't had any problems with vision, correct? You're not having blurred vision, seeing any dark spots? Okay. And how about headaches? Do you get headaches or are you not a chronic headache person? Good. Okay. Very good. And how is your diet? Do you say that you would eat a pretty balanced diet? Do you incorporate your proteins such as meat, eggs, along with your carbohydrates and breads and stuff like that? Okay, good. And are you a smoker? Cigarettes. Okay. Yes, it's okay. Many people ask, smoke what? Every time they get that question. And you drink alcohol? Occasionally? Okay. What would you say if you had to break it down into a week? 2 to 3 drinks a week or 10 to 15 drinks a week? Okay, so very moderate to light. Good. And do you use any substances or drugs such as narcotics? Do you do any injection drugs such as meth or anything like that? Okay. This is not to insult you at all. This is just legitimate questions. We just want to make sure we know your lifestyle, basically. Okay. And of course, there is no judgment. You can always be completely honest with me. Never any judgment. Alright. So what I'm gonna do is go ahead and listen to your heart and lungs. Make sure that all sounds good. Like I said, we'll check your blood pressure. Make sure you're falling in a normal rate. If you have any questions for me or anything you can think of that maybe is a concern or any changes that you've had recently, we can talk about that. Alright. Okay, so I know this is probably a little bit cold. Just bear with me. Okay, go ahead and take a deep breath in. Now blow it out. Okay, good. And just breathe normally. Okay, and I'm just going to listen around your back. Good. And take one more deep breath in for me. Okay, good. sound good. I don't hear anything abnormal. Your breathing is good. And your heart sounds good as well. So I'm gonna just write this down. Your lungs sound clear. It doesn't sound like you have any fluid in them, which is good. We would probably know if you did. Let's see. Do you have asthma? Okay, just wanted to check because I didn't ask you that. Okay, good. And do you have any change in your health status since last year? Is there anything you've noticed that decreased or increased even? Or do you feel like it's pretty stable? The same? Okay. Do you suffer from a seizure disorder or no? Okay. Good. And are you diabetic? Okay. Just want to keep track. So, what I have is a blood pressure cuff. This is going to tell me your blood pressure along with your pulse. And what I want you to do is just sit with your feet on the floor. Don't want to have your legs crossed or anything, so just sit normally. Okay, this is what it looks like. It's going to go around your wrist and it will constrict to get tighter. So here we go. Just go ahead and put your arm out for me. Okay. All right. What I want you to do is bend it up towards your chest here. Okay. Good. Now I'm just gonna start it. Just hold still. Okay. Good. Almost done. It's not too uncomfortable, right? Okay. All right. Okay, looks good. Blood pressure and pulse both seem normal. And how much stress would you say you have in your life? Do you have pretty low intensity stress? Do you have a lot of stress? Moderate? Okay. Well, basically, we just want to make sure that if you do either a job or you have family stress, we want to make sure that we're testing you quite often for your blood pressure to make sure that you don't develop high blood pressure, okay? Because that can lead to many, many issues. So we want to stay on top of that. Other than that, you seem very good to me. I can give you the okay that you are clear. Is there any aches and pains that you deal with? Anything that seems abnormal or any other concerns? No? Okay. Well, other than that, everything, looks good. If you have anything that you think of, or if something comes up out of nowhere, you start to have a weird pain, come back and see me, or you can just call. I can talk to you on the phone, just address the issue. But yes, everything looks good. You seem very healthy. That is a good thing, so stay on top of that. But other than that, thank you so much for coming to see me. It was very nice to meet you again. I hope you have a great rest of your day. Stay healthy. Remember what they say, an apple a day keeps the doctor away. Bye-bye.